Thank you very much. Good morning, everyone. I'm here to do a presentation and demonstrate that when we improve the community-based reporting and M&D systems, we help sustain community-based led responses. I'm going to give a case of Kenya. As a background, Kenya has a generalized HIV epidemic with a HIV prevalence of 5.6%. This is according to the Kenya AIDS Indicator Survey of 2012. We reported a peak adult prevalence of 12% in the mid-1990s. We estimate that we have about 1.6 million people living with HIV in 2013. Kenya has over 20,000 registered community-based organizations providing community-based HIV services, and it is acknowledged that CBUs were the first to mobilize and provide HIV prevention care services when not much was known about HIV and its response, as we know now. Significant HIV program resources have been spent on CBUs over the years. According to our AIDS spending assessment, over 30% of our resources are dedicated to community-based organizations. There is evidence that community-based response is key in HIV programming. A recent evaluation done by World Bank and DFID in 2010 showed that high CBU engagement results in greater HIV knowledge and behavior change, and this is through increased condom use at high-risk sex. The evaluation showed that CBU's engagement on national policies have a significant impact on political and legal transformation, and this is mainly in the area of advocacy for human rights. The issues that we had is that we lacked a dedicated reporting system for community-based organizations. We were unable to demonstrate the community-based organization contribution to the national HIV response. We were unable to link the community-based organization expenditure to the program results. We were focusing more on accountability of funds, but not on the results that were being delivered by these community-based organizations. And this was a threat to the sustainability of community-based led response because we could not prove the results we are getting out of the funds that we are using. So in the year 2006, the National AIDS Control Council and partners prioritized to develop a dedicated community-based program organization reporting system. And by doing this, we developed a reporting tool, a database, and user guide tools. We piloted the system and rolled out the training of over 12,000 community-based organizations. There has been continuous capacity building of CBUs on information management thereafter. This slide shows the data flow of data from community-based organizations, and you can see the data would come from community-based organizations or faith-based organizations or NGOs, and they would report to the lowest decentralized coordinating structure we call constituency control committees. To also meet the reporting requirement of the partners, the organization would also give a report to their partners, whoever is financing them. And as you can see, the data will flow upwards, up to the National AIDS Coordinating Agency. We have recorded a number of achievements using this system. Over the years, we have seen improved rates of reporting by community-based organizations from below 2,000 to over 8,000 community-based organizations reporting to their local AIDS coordinating agencies every quarter. We have seen better coordination at the decentralized levels because these structures are aware of who is doing what and where. We have also seen improved national project performance. Sub-projects with CBUs are able to achieve their project targets, and there was evidence to verify that these targets have been achieved. We have seen better validation through the beneficiaries, with a lot of beneficiaries validating that, yes, we have received these services from these community-based organizations. We have seen better value of money, and we are seeing those organizations that have been reporting more frequently, demonstrating more results for less amount of funds given. They are able to procure their goods and services at a lower cost compared to those who have not been reporting frequently. We have seen community-based organization program sustainability because those organizations who have reported using this system for some time are able to mobilize funds from multiple donors rather than one. They are able to have better capacity to write good proposals that are able to attract funding, and they are likely to remain active, which means there's no long spells of inactivity due to lack of funds. We have also witnessed improved coordination due to this reporting, because those organizations that are reporting frequently are likely to be involved in planning, implementation, and review of HIV programs, and they are more recognized by their communities and beneficiaries as valuable partners in the communities. We have learned a number of lessons that when we enhance community monitoring and evaluation system, it greatly improves community-based organization performance. They are able to do good resource mobilization for community response, and therefore sustaining the community-based organization response. We have also learned that there is improvement of the quality of the services that these community-based organizations are providing at the community level. We have also learned that for this system to work, it requires a strong decentralized coordination structure, because this structure will continue to provide capacity building and also improve information use for program improvement in the communities. In conclusion, I want to say that strengthened community-based reporting systems improve sustainability of community HIV-based response. I want to acknowledge USAID through measure evaluation. They supported us greatly in rolling out this system, UNAIDS, and National Monitoring and Evaluation Technical Working Group. Thank you very much.